Okay, so good evening, everyone. Today we are in our week 5 of the live interactive session for the course Maternal Infant Young Child Nutrition. And today we will be discussing questions. Around 21 questions we have today with us, and we will try to finish it as fast as possible. The only problem is starting is people keep joining, and it is disturbing when I have to accept and go with the questions as well. But okay, fine, we'll start early today. And yeah, I hope everyone knows what is the rule. Please keep yourself mute for the audio as well as video throughout the class. You can communicate with me through the chat box. Okay, whatever doubts, queries you have, please write down in the chat box throughout the session. Do not unmute yourself. Okay, and the second thing is, you know the rules. If someone is new, for them I'm repeating again that I'll show you the question. I will give you 1 to 2 minutes time. You have to write down your choice of correct option in the chat box, and after 2 minutes I will say what is the correct answer, and if we need any explanation for that question we will discuss. Otherwise we'll move on to the next question. I hope I am clear with this. I hope you all can see the slides, and my audio is clear. Okay, so we'll start with the first question for today. Okay, so the first question is, early skin to skin contact in the operating room is important for the mother and the newborn. True or false? I'm requesting everyone who are joining late to the class, please be on time. Please be sharp at 7 p.m. to join the class. This week I have preponed the class to Monday because I have some urgent work for tomorrow. But otherwise, every Tuesday we have the class at 7 a.m. and I join by 7 p.m. and I join by 7 p.m. So please, I will be very happy if you all try to join at the same time so that it doesn't cause any inconvenience for the other people who have joined early. Okay, if you all join by 7:05, I'll be more than happy to start the class by 7:05. Okay, it's only a chaos if I have to keep accepting the students throughout the class. It's disturbing, and I can't keep admit all. That also I'm not allowed. So I have to keep seeing who is coming to the class, and I have to admit them. So yeah, it will be very helpful if you guys be on time to the class, right? Yeah. So the today's questions are very easy. I have not kept explanation for each and every question. For some questions I have kept which actually needs a fact or information. Otherwise we can just discuss it verbally, or if anyone has any doubt for that particular question which doesn't have an explanation, they can ask as well. If I know, I'll say. If I don't know, I will repeat and I'll come back to you. Okay? Okay. Is everyone done with the first question? Okay. Let's see what is the correct answer to first question. The correct answer is true. Right? Early skin to skin contact in the operating room is important for the mother and the newborn. So the first embrace, what is called as when the mother embraces the child for the first time after it is born, is called the first embrace, and that skin to skin contact or that skin to skin cuddle between the mother and the baby is really needed for these things. First of all, we dry the baby immediately after birth, and then early skin to skin contact between the mother and the baby is needed until the completion of the first breastfeed, right? And the appropriate timed clamping and cutting of the cord is also necessary, and then initiation of the exclusive breastfeeding. And we have already discussed what is exclusive breastfeeding, right? Okay. We'll move on to the next question. Milk from mothers of premature babies is rich in insulin, infection fighting proteins, oxytocin, sugar? Start answering. I hope you all could find out my YouTube channel, and whoever is missing the session because of any kind of emergency, they can go back and see the recording as well. And also, I'm sharing the presentations in the folder. I think you all have the folder link as well. So, yeah, I hope no one is having any problem with those things. It's always good to join the live session than to see the recording. Recording will always feel bored, will feel bored if you watch the recording because there's nothing but only discussion of questions, right? It's always better to be live and answer with me, discuss with me the questions. And as Hema said, your exam pattern, it will be objective. So these questions are very important from your exam point of view. Obviously, whatever previous year questions are there, whatever current year assignment questions you are getting, all of those are included in your syllabus. Right? The more objective questions you practice, the more you get acknowledged towards the course, right? Um, taking, taking. Okay, let's see what is the answer to the second question. Answer is B. I think everyone has given the correct answer. Infection fighting proteins. So the breast milk helps protect your baby from infections, particularly of their gut. And the premature babies are more likely to get infections, obviously, and thus it contains hormones. Breast milk contains the hormones, nutrients, and growth factors that help your baby to grow and develop, right? So, the milk from mothers for premature babies are rich in infection fighting proteins. Okay. Okay, great. We'll move on to the next question. Ensure dash of uninterrupted skin to skin contact in the immediate post delivery period. 30 minutes, 10 minutes, 1 hour, or 20 minutes. Okay, I guess everyone is done. Let's see what is the correct answer. The correct answer is C. Ensure 1 hour of uninterrupted skin to skin contact in the immediate post delivery period. So, 1 hour of uninterrupted without any disturbance skin to skin contact between the newborn baby and the mother is very important, and we have discussed why already. So that first embrace, and so that the baby can get acquainted with the mother, and they will start crawling towards the breast to get the exclusive breastfeeding, right? Okay. We'll move on to the next question. What is the role of immunoglobulin A antibodies present in the cholesterol? It acts as a food for good bacteria. It binds to the germs and prevents them from entering baby's blood. It helps the baby in passing the first stool. It promotes the growth of the new blood vessels. Start answering. Okay, is everyone done? Fine. Let's see what is the correct answer to this question. The correct answer is B. It binds, obviously, it is an antibody, and the role of IgA is the antibody which is found in maximum amount in the colostrum of human milk. In other animals, the antibodies which are present in the colostrum differs, and the function of IgA antibody in the colostrum is it binds to the germs and prevents them from entering the baby's blood. Basically, it prevents the baby from having any kind of infection, right? So here you can see what is the function of each antibody. There are five kinds of antibody which are found in our body, which are found in different parts. IgA, it is found in the mucus, saliva, tears and breast milk. It protects against the pathogens. IgD is a part of the B cell receptor. Its function is to activate the basophils and mast cells. IgE, it is again for allergic reactions. IgG, it is secreted by the plasma cells in the blood, and it is present in the placenta. It is able to cross the placenta into the fetus, right? Again, it's a part of the baby and the mother. IgM, it is present on the surface of a B cell and is secreted into the blood. It is responsible for the immunity, right? Okay. We'll move on to the next question. Which of the following options stimulates the baby to salivate? The smell of her hands, the smell of the mother, the smell of the outside atmosphere, the smell of the medicine. This is a very common thing which we must have observed in the babies around us, what they do. And I think every one of you can give a correct answer for this question, right? Yeah, I forgot to say, keep noting down how many correct answers and how many wrong answers you all are giving. If you want to share your score at the last, that will be great. Okay, out of 21 questions we have today. I hope you all are able to solve the current year assignments properly. I hope you all are getting full marks in those because those marks are going to be counted for your exams, right? You're unable to see the screen, Gayatri. Is it a problem for her or everyone? Is everyone else able to see? Okay, Gayatri, then do one thing. Leave the class and join once again. Okay, I hope we are done with this question. Let's see what is the answer. The correct answer is the smell of her hands. All most of the times we see babies sucking their own fingers or the thumb finger. So the smell of their hands only stimulates the baby to salivate, right? Okay. We'll move on to the next question. Sixth question. Breast crawl should not be performed for which of the following babies? Unstable babies with low birth weight, babies who cry well immediately after birth, babies born naturally by natural delivery, babies born by cesarean delivery. Still you have same problem. Still you are unable to see the screen. Like I don't know what I have to do. I think everyone else can see. Okay, good. Okay, I hope everyone is done with this question. Let's see what is the correct answer. The correct answer is A. Unstable babies with low birth weight. So first of all, whenever the skin to skin contact with the baby and the mother happens, first the baby gets acquainted with the warmth of the mother, and then after half an hour or so the baby starts crawling towards the breast. But it may be a problem if the baby is of low birth weight, then the baby is unstable and they may not be able to move or crawl towards the breast. So we should not allow the babies who are having a low birth weight to crawl towards the breast. Right? Okay. 7. A mother is doubtful about cholesterol, which is the first milk produced by the breast after the baby is born. Which of these is not true regarding cholesterol? Cholesterol should be discarded and it should not be given to the baby. Cholesterol contains good fats. Cholesterol is rich in vitamin A. Cholesterol is creamy, white or yellow in color. Okay, I hope everyone is done. Let's see what is the correct answer to this question. Correct answer is A. Obviously, colostrum should not be discarded and it should be given to the baby. So the statement given here is false, right? So, as we have discussed, colostrum is very important. It is the first milk produced by the breast of the mother and it contains IgA antibodies, which is very important for preventing the baby from getting any kind of infections, right? Okay, we'll move on to the next question. Eighth question. A mother fed colostrum to her baby soon after which the baby passed black stools. What should she do? Immediately inform doctor as passing black stool is a sign of infection. Immediately stop feeding colostrum to the baby. She should not worry as colostrum helps clear out bilirubin from the stool. Should not worry as colostrum helps clear out iron from the stool which is responsible for the black color. Start answering. Okay. Is everyone done? Yeah. Let's see what is the correct answer to this question. The correct answer is C. She should not worry as colostrum helps clear out bilirubin from the stool. So, one more function of the colostrum is that colostrum helps in clearing out bilirubin from the stool. So, what is bilirubin exactly? It is the waste product produced by the dead red blood cells, and it should be taken out from the body. So, if the baby is not fed enough mother milk, they can have jaundice because of the reabsorbance of bilirubin in the blood. So, a very good function of the colostrum is it flushes out bilirubin from through the stool and it helps in preventing jaundice. So whenever a baby they are not able to take uh, sufficient mother milk, they can have jaundice, which is a very serious issue. So that's why it is always said that colostrum is very important for the baby as soon as the baby is born, right? Okay. Let's see the ninth question. Neonates necrotizing enterocolitis is a serious condition caused due to inflammation and damage in the liver, intestine, kidney, or lungs. Okay. Is everyone done? Yeah. Let's see what is the correct answer to this question. Correct answer is B. So, this neonates necrotizing enterocolitis is a serious condition caused due to the inflammation and damage in the intestine. Here you can see the inflammation happens in the lining of the intestine, and it generally happens in the premature babies. The inflamed bowel, which is a serious condition called as necrotizing enterocolitis. Right? Some of the signs that your baby is suffering from this condition is bloody stools or poor feeding or feeding tolerance, like that. Okay. Okay. We'll move on to the next question. What is the correct definition of golden hour? It is the hour when sunlight is maximum during the day. It is the first hour of the newborn after its birth. It is the hour when a baby first starts eating solid foods. It is the hour when the baby smiles for the first time. Okay, I guess everyone is done. Let's see what is the correct answer to this question. The correct answer is B. It is the first hour of the newborn after its birth, because that first hour is very critical for the newborn to get acquainted with the mother as well as breastfeeding. Right? We'll move on to the next question. If during the surgery doctor sense a medical emergency related to the mother, skin to skin contact in the operating room should be completed anyhow, may not be completed. Start answering. Okay, everyone is done. Let's see what is the correct answer to this question. Correct answer is B. May not be completed. So, if there is a cesarean delivery and the mother is going through a medical emergency just after the birth, then you can't allow the baby to crawl on the mother, or they may not have a skin to skin contact for first few hours, which is, although it is a golden hour for the baby, it has to be prevented, right? Because it may be dangerous for the mother, right? Okay. We move on to the next question. There are dash natural stages or behaviors of a baby after birth. 9, 8, 7 or 6. 7 or 5. Sorry. Let's see what is the correct answer to this question. Correct answer is A. There are 9 natural stages or behaviors of a baby after birth. So, what are these 9 stages? I have listed out here from a research paper. You can see first is the birth cry, intense cry just after birth. Second is the relaxation stage, infant rests, no activity of mouth, head, arms, legs, or body. Third is the awakening stage, infant begins to show signs of activity. Active stage, infant moves limbs and head, more determined movements. Resting stage, again after some movement, infant rests with some activity such as mouth activity or sucking the hand. 7 is familiarization. Infant has reached areola or nipple. After half an hour, there is familiarization with the environment. Infant will start crawling, has reached the areola or nipple with mouth position to brush and lick areola or nipple. Eighth is the suckling stage. Infant has taken the nipple in the mouth and commences suckling. Ninth is the sleeping stage. After these, the last stage is infant closes eyes and falls asleep. Right? Okay. We'll move on to the 13th question. The IMS Act is considered violated if a food is prompted by any means specifically for children up to 2 years of age. 3, 2, 1 or 4. Okay. Everyone is done? Let's see what is the correct answer. The correct answer is B. 2. The IMS Act is considered violated if a food is promoted by any means specifically for children up to 2 years of age. So, what is the formula for full form of the IMS Act? It is the Infant Milk Substitutes, right? Act. So, what is the goal of this act? Is that any formula food should not be promoted specifically for children of 0 to 2 years of age. This act has been made to prevent any kind of misconception about breastfeeding, and to always promote breastfeeding is very important, and no formula food is enough so that they can uh, prevent malnutrition in the babies, and they can also enhance the importance of breastfeeding, right? Will- So the act is to provide for the regulation of production, supply and distribution of the infant milk substitutes, feeding bottles and infant foods with a view to the protection and promotion of breastfeeding, right? And ensuring the proper use of infant foods and for matters connected therewith and incidental thereto, right? Okay, I hope this is clear. We'll move on to the next question. 14th question. Animals' milk has high amount of a type of protein called dash, which is not easily digested by the infants. Whey, casein, lactose, triglyceride. I hope till now everyone is clear with the questions we are discussing, and they are able to understand the questions properly, and they do not have any doubts, right? I'm sure Rupal ma'am is teaching very well, and she is giving clear concepts for each and everything which we have included in the course. And yeah, I'm just revising. We are just here to revise the topics again, basically more of a practice for you all, right? Okay, is everyone done? Let's see what is the correct answer. B. Animal's milk has a high amount of a type of protein called casein, which is not easily digested by infants. Not just infants, sometimes casein is not be able to digest it by adults also. Right? Casein forms a tough, hard to digest curd in the infant's stomach, whereas whey forms soft, flocculent, easy to digest curds. The amino acids taurine and cysteine are present in high concentrations in breast milk than cow milk. These amino acids may be essential for premature infants. So, breast milk is much more easily digestible by the infants than cow milk because it has casein in it, which is a tough and hard form to be digested in the infant's stomach. Right? We'll move on to the next question. Dash is the same for all mothers and babies. IMS, breast milk. Okay, I guess everyone is done. Let's see what is the correct answer. The correct answer is A, IMS. The IMS Act is applicable for all mothers and babies and for everyone. No one should promote the supply of infant foods or infant milk substitutes or feeding bottles for the children aged from 0 to 2. Right? Okay. We'll move on to the next one. In the longitudinal position for skin to skin contact, the baby's chest, abdomen, and legs should rest on mother's lower chest and upper abdomen or upper chest and neck. Okay, let's see what is the correct answer. The correct answer is the lower chest and the upper abdomen. So while the skin to skin contact, the baby is rested on the mother's lower chest and little bit below the lower chest, that is the upper abdomen area. Okay. Okay, we'll move on to the next question. Colostrum is secreted only until the first dash after delivery. 2 to 4 days, first few hours, 15 days, or 1 month. I'm happy that all of you are able to answer the questions. I feel that yes, you all have read and attended the lectures and have come to the class. So that's really great. Okay, I hope everyone is done. Let's see what is the answer. The answer is 2 to 4 days. So colostrum is secreted from 2 to 4 days after the delivery. We'll move on to the next question. A baby is not able to breast crawl effectively. This could be because he is incorrectly placed. In which of the following way should the baby be positioned? The baby's back should touch the mother's tummy. The baby's hands should touch the mother's tummy. The baby's tummy should touch the mother's tummy. The baby's sides should touch the mother's breasts. Already we discussed how the baby should be positioned, right? Based on that, you can give this answer as well. Okay, is everyone done? So let's see what is the correct answer. The correct answer is C. The baby's tummy should touch the mother's tummy. Then only it will be like it is placed on the lower part of the chest and upper part of the abdomen. Right? That's what we discussed. Yeah. We move on to the next one. Dash present in the colostrum is responsible for yellow color. Omega 6, protein, carbohydrate, beta carotene. Let's see what is the correct answer. Correct answer is beta carotene. So beta carotene is a carotenoid present in the colostrum which leads to its yellow color. So generally it has a function of as an antioxidant which is present in the milk, right? And it helps in the defense of the newborn baby for fighting against infections as well, right? Okay. On to the next question 20. Breastfeeding is a skill. It takes time and effort to learn or assist the proper breastfeeding technique. True or false? Students who are late, I would like to say we are already about to end the class. So if you have missed the class by any chance, I am recording the class. You can go and see in the YouTube channel in 1 to 2 days. Okay. Let's see what is the correct answer to this question. The correct answer is true. Obviously, breastfeeding is a skill, proper positioning, and all time, effort it's needed to learn and assist the proper breastfeeding technique so that it is not nipple feeding but breastfeeding. The positioning of the baby for the mother is very important to learn so that they can be breastfed effectively, right? Yeah. On to the next one. This is the last question. For premature babies, dash is very useful. Cradle hold, kangaroo mother care, football hold, or sideline hold. So these are the type of positions of breast while breastfeeding or while holding for the mother baby. So yeah, thing is a skill and you have to learn, and it is always good if someone is there to teach you these things. Yeah, I hope everyone is done. Let's see what is the correct answer. The correct answer is B. For premature babies, kangaroo mother care is very useful. So, what is kangaroo mother care exactly? Kangaroo care, also known as skin to skin contact, and this has great benefits for the newborns, but it is especially beneficial for the premature babies, right? So, how to practice the kangaroo care? Hold your diapered baby on your on your bare chest. Place a blanket over the baby to keep her warm. So, what are the benefits the premature baby can get from kangaroo mother care? It regulates the baby's heartbeat, breathing, and body temperature, helps babies spend more time in deep sleep, improves baby's weight gain, increases the mother's milk production for breastfeeding, and increases the bonding between the baby and the mother for the baby and the father if he is practicing kangaroo care. So, the first early hour of skin to skin contact is very helpful in creating a bond between the baby and the mother. And for the premature babies, this kangaroo care, the practice of kangaroo care is very beneficial because of these points listed out here. You can check once more when your this presentation will be shared with you. Okay. 4, 5, 10, 17. Why I have to repeat again? I can show you the questions. Even if you have missed the questions, you have the recording, you have the PPT, you can go back and see it again. 17 I will see show again because two people have asked for it. Colostrum is secreted only until the first 2 to 4 days after the delivery. If you people are noting down questions, there is no need. You will get the presentations, right? Okay, I'll show. Fine, I'll show it. 4, 5, 10. Okay. Whoever got full marks, great. 19 out of 21 is also great. I know you people are very good in this course. 10th question is, what is the correct definition of golden hour? The correct answer is, it is the hour when a baby first starts. It is the first hour of the newborn after its birth, right? And 4, 5. Which of the following options stimulates the baby to salivate? It is the smell of her hands. And the fourth question is, what is the role of immunoglobulin A antibodies present in the colostrum? So the correct answer is, it binds to the germs and prevents them from entering baby's blood. Is it fine, Gurnur? Yeah, great. So whoever shared their marks, commendable. You all have done great, and I hope you all will do the same for the upcoming weeks, and we will be able to complete this live session for this course successfully, right? So keep learning, keep seeing the lectures, keep revising the course for every week. It will help you for your knowledge for which you have joined the course as well as for your exams, right? Okay. Thank you everyone. We'll meet again next Tuesday, 7 to 9 p.m. I hope everyone will be on time. Okay. Thank you. We'll disperse.